Do you have pain around the elbow? Or are you having trouble with gripping or find that your arm becomes quite sore after working for some time? Or maybe you're finding that your elbow pain is always keeping you up at night. Hi, my name is Quinton and I'm a physiotherapist here at Pain Free Physiotherapy and Allied Health. And I'm here to talk to you about tennis elbow. Tennis elbow can also be known as lateral epicondylitis and often presents as pain on the outside of the elbow, and this can often involve the forearm and wrist extensor muscles. Now, one thing to note, just because it's called tennis elbow doesn't necessarily mean that only tennis players will suffer from this condition. Now, this condition is often referred to as an overuse injury. That means that it can be caused from repetitive wrist or arm movements. So this could include movements where the wrist goes into wrist extension, or if the wrist goes in or out like that. So maybe, for example, it could be painters that have been painting for a long time, or office workers that are always working at the computer all day. Or it could be sports that involve lots of one-sided movements like tennis, badminton, or even javelin throw. Now, you may have also heard of the term golfer's elbow. Now, this is quite similar in terms of how it can occur, but the pain is predominantly on the inside of the elbow rather than the outside. Usually, people with tennis elbow will complain of pain on the outside of the elbow, and it's actually quite tender on this bony part here when they touch it or press on it. The pain can radiate anywhere into the forearm, the wrist, or even go up to the arm into the shoulders, and aggravated from doing gripping tasks or from moving the arm back and forth. Now, people can vary in symptoms. Some may even complain of neck stiffness or find that there's some swelling in the arm as well. Your doctor may refer you to get an ultrasound scan or an MRI scan to see if there's any damage or inflammation to those muscles or tendons. Now, it's important to identify and then reduce or avoid those aggravating and painful activities. Now, ice can also be applied to the area if there is any inflammation and reduce any swelling. Now, your doctor may also prescribe you certain medications such as pain relief or anti-inflammatories if they do find that your tennis elbow is caused by inflammation. Or they may even give you corticosteroid injections. Now, corticosteroid injections may have a short-term benefit for some people. However, it's found that multiple injections over time may actually cause damage to the tissues, so the muscles and the tendons, and they can actually become brittle and weaker. So long-term effects of corticosteroid injections aren't too promising. There was a study comparing the effectiveness of physiotherapy compared to the use of corticosteroid injections and no intervention over 1 year. And it's actually shown that physiotherapy intervention results in a better outcome compared to no intervention in the first 6 weeks, and physiotherapy is better than corticosteroid injections after 6 weeks. So the short-term benefits of corticosteroid injections actually disappear after 6 weeks and tend to have higher recurrences. So at Pain Free, we're experienced at using a holistic approach to fully assess and treat your symptoms. That means we look at the whole body rather than just focus on the one area that you complain of pain. So instead of just focusing in and around the elbow, we'll be looking up in the neck, the shoulders, the back, all the way down to your feet to try and identify the cause. So this will all be part of a head-to-toe examination. Now, contrary to the conventional approach that just focuses on the elbow, the cause may actually be found outside the elbow. So this can often be due to overuse of muscles and joints in other parts of the body. For example, if you're always sitting in awkward sitting posture for the whole day, or it could be just referred pain from the neck. So tennis elbow can be a very stubborn condition. It can be resistant to improvements or intervention and quickly become chronic and recurring. Now, the reason being is that most conventional approaches always focus in and around the elbow. So it's really important to have adequate rest, from those aggravating activities and that the cause is correctly identified and addressed. At the end of the initial treatment session, we will always go through a treatment plan that outlines 3 main things. Number 1, what is the cause? Number 2, what treatment do you need? And number 3, how many sessions or how long will it take for you to achieve your goal? Let me show you some ways to help self-manage at home. If we find that doing a lateral glide to the elbow joint helps, this is how you can do it at home by yourself. First, you need to find a pillar or the corner of a wall like this. Next, stand sideways to the wall with your palm facing up. Now you want to position your elbow so that the tip of the elbow is out in the open and not blocked by the wall. Then you want to position your other hand as close to the joint as possible, so on this side of the elbow crease. Now you can apply a glide towards the wall and then grip with this hand here. And the key thing is that it should be pain-free. Now you can change the angle of force a little as well to see which angle suits you the best. But make sure your grip is pain-free. If you find that posture is a factor that is related to your tennis elbow and infraspinatus is the main cause, this is how you do a self-release for the infraspinatus. And all you need is a pocket physio. You want to place it up against the wall, and usually we will let you know where the infraspinatus spot is, and you can lean against that point. And you'll actually feel quite sore if you move side to side on the right point. So that's the self-release for the infraspinatus. So if you or anyone you know is suffering from tennis elbow and you're still not getting the results that you want from other treatments, feel free to contact our clinic and we'd be happy to answer any questions you have about tennis elbow.